Hello everyone, it's good to be with you again. I'm here today to provide you my third quarter update for the Central Texas Veterans Healthcare System. The last update I provided you was published around April 28th, so we've had a little bit of time since then, so I'd like to update you on some things that are happening both in our healthcare system and at the national level. So why don't we start at the national level. Many of you are aware that Secretary Shulkin is no longer the Secretary of the Department of Veterans Affairs. And we now have an acting secretary by the name of Peter O'Rourke. Peter is the Chief of Staff for VA and was recently appointed the acting secretary when our new nominee, Robert Wilkie, was nominated officially by President Trump to be the Secretary of VA. Mr. Wilkie is a veteran, having served in 2 military branches. I had a brief opportunity to interact with him, and assuming his confirmation process runs through, I think we'll be extremely happy and pleased to have him as the Secretary of VA. There have also been some pretty significant legislative events since I last updated you. One of the most important was President Trump's signature on the Mission Act. This was joint legislation that was signed obviously by the House and the Senate and signed by the President in June. One of the most significant aspects of the Mission Act is its complete transformation of VA's purchase care programs. Many of us have become accustomed to referring to the Choice Program. This Mission Act will actually abolish the Choice Program in approximately March of 2019 and replace it with a comprehensive purchase care program that will merge the multitude of community care programs we have into one. But there's also another very unique and important aspect of how the Mission Act has changed our purchase care programs, that being the inclusion of quality metrics. So in addition to leaving the 30-mile and 40-mile parameters that many of us have become accustomed to since 2014, under the Mission Act, which we'll see additional guidance for, veterans will receive more information about the quality of care that's being provided in their VA healthcare centers to be able to compare that to the care that they receive in the community and make consumer decisions as to where they would like to receive that care based upon the quality metrics that are being publicly reported. So there'll be much more of that to come. I've shared some of that data with our clinical and administrative leaders in the organization. And as VA publishes the guidelines and gives us a bit more detail on how we're going to deploy the Mission Act going forward, I'll be prepared to share more of that information with you. But the Mission Act also included some other things. I'll just hit a few of them. For example, the Caregiver Support Program, which has been in place now for a number of years, but has been a program that has been limited only to post 9/11 veterans. The Mission Act actually expands that to make all veterans eligible for the Caregiver Support Program. It actually increases ceilings for our education debt reduction program, giving us the opportunity to offer clinicians more funding to work at VA when they finish their medical educations. And it also creates a pretty unique medical scribe program to give facilities the opportunity to pilot using medical scribes in our clinical environments. Again, much more about the Mission Act. We're going to be publishing a fact sheet on our Central Texas SharePoint and internet website, so look forward to seeing that here in the coming days after this video is published. A few key staffing changes I'd like to update you on in the organization. Many of you are aware that Brian Sisk, our Associate Director for Patient Care Services, did leave us effective June 15th. Brian took an excellent opportunity with HCA, and he and his family are on their way to Nashville, Tennessee. So we gave Brian a hearty farewell and wish him and his family our best. I'm also pleased to welcome Leslie Whitaker as our Acting Associate Director for Patient Care Services. Leslie joins us from Vision 17, where she's a quality management nurse full-time. I've had a number of opportunities to interact with Leslie prior to asking her to come into the acting role, and I think she's going to be a major asset to our organization while she's here covering for up to the next 90 days. She's been with VA for approximately 5 years, and prior to going to the Vision was the Chief of Quality at the Amarillo VA Medical Center, and obviously has a myriad of private sector experience as well. A few other staffing changes I'll update you on. Dr. Hussein, Nasir Hussein, has been our Deputy Chief of Staff for a number of years. I'm pleased to announce that Dr. Hussein has taken a new role with Central Texas Veterans Healthcare System. We created a new ACOS, or Associate Chief of Staff, for our outpatient clinics, so all of our CBOCs, so that would include Bryan College Station, Palestine, etc. Dr. Hussein is now the ACOS with responsibility for our CBOCs as well as our telehealth programs have all been consolidated under his leadership. So we look forward to his success in his new role. We've also made a number of key leadership selections. I won't provide names to you now, but I do want you to know that we've made selections for these positions and are actively working on on their start dates. That includes a new chief of engineering that has been selected, a new chief of safety and occupational health that's been selected. Both of those are external candidates. We also have made selections for our chief of dental service, chief of laboratory and pathology medicine, and we have a new chief chaplain. So a number of new leaders joining the organization, and I'm excited to have them and ask that you welcome them when you do meet them. Since my last update to you, we've also had a number of external surveys. I'll start with our Office of Inspector General CHIP review, which was a redesign of what we used to refer to as CAP surveys that the OIG conducts at each VA facility every 3 years. So we did have our first survey that happened in early June. Central Texas Veterans Healthcare System did really well. I received a number of compliments from the surveyors, a number of best practices that they identified. And as always, there are several recommendations. We've already reviewed their preliminary findings with those services that have actions. And we'll ask those leaders and obviously you all to work with us as we ensure that we are in an always ready position. We also had a review by the FDA for our blood bank, and that's obviously part of pathology and laboratory medicine. I believe that review occurred in May. Again, the service did well, and there were a number of recommendations that pathology and laboratory medicine is actively working. The week of June 25th, we have a CARF survey. This survey is going to be specific for our mental health programs. They'll be looking at our MICM programs, some of our residential rehab programs. We've historically done really well with our mental health CARF surveys, so look forward to that success. We also have a very first for logistics, as VA has heightened its sensitivity to logistics related operations throughout the Department of Veterans Affairs. We'll have our first what's called QCR, which is a specific review for our logistics department. That will also occur during the week of June 25th, and also, again, looking forward to their success. A few performance updates for the healthcare system. As you all know, we've talked about SAIL on a number of occasions. There are actually two different SAIL reports that publish. We have a SAIL report that publishes that talks about hospital performance, and there's another SAIL report that's specific to our CLCs, or community living centers. So we did receive the first quarter FY18 results for a hospital-based SAIL. We remain a 3-star quality organization, sustaining a lot of the improvement that we were recognized for in 2017. I am expecting the second quarter results for hospital-based SAIL to be out pretty soon, and when they are, I will share those with you. An area that has been of increasing attention for the healthcare system is adverse avoidable events. So we have a number of teams working on that, and expect us to move out of the 5th quintile there into the 1st quintile, where I really believe this healthcare system can perform. But again, as we get second quarter hospital-based SAIL results, I'll share those with you. We have received second quarter results for our CLCs. Because we operate community living centers on both our Temple and Waco campuses, we get star ratings for each one of those campuses independently. So our Temple campus is a 4-star CLC, and our Waco campus achieved 3 stars. The CLC SAIL scores come from 3 different parameters where we are scored on staffing, specifically nurse staffing. They look at our survey results. We don't use Joint Commission in our nursing homes. We use an organization called LTCI, or the Long-Term Care Institute. So that's the second variable. And the last is a quality score. So as an organization, we have achieved 4-star in Temple, 3-star in Waco, but our actual quality score is an area of emphasis that I've continued to work with our chief of staff, our nurse executive, and our ACNS and ACOS in those respective areas, and expect to see that quality score continue to improve to get us to 5-star designation in both of those campuses, which I believe we are capable of meeting. So a few updates on construction. I won't go through all of the construction projects or lease projects. We just won't have time for that, but I'll hit a few highlights for you. You've heard me talk for several quarters now about a new clinic that we're going to be opening in LaGrange. This was a unique partnership that we entered into with St. Mark's Medical Center, working in collaboration with veteran service organizations and the county officials there in LaGrange, Texas. I am happy to announce that on June 18th, we officially opened that clinic. The week prior, we had a really nice ribbon cutting, a lot of folks in attendance. But June 18th, the new LaGrange clinic did officially open and became a VA staff site. So we'll give you more updates there as necessary. I'm also pleased to announce that we have officially awarded our new lease for Cedar Park. I've shared with you a plan to replace the current site with a site about twice its size, and we've done that. Awarded a 20,000 square foot lease in Cedar Park. It'll be adjacent to Cedar Park Regional. We're actively finalizing our build-out plans for that site, working collaboratively with the staff to be certain that their voices are heard and that they will have direct input and insight into what the new environment that they'll be providing care to our veterans will look like. So definitely looking forward to that, and there'll be some press releases soon, so look for those. Here at our Temple campus, we did officially start construction of our second cath lab. That construction started approximately June 4th. And we're expecting it to run about 6 months for construction to when the equipment is actually installed. So look for more updates on the second cath lab. And again, I'm sure many of you have seen the halls and walls if you're in the facility. And our engineering in-house crew just continues to do a great job modernizing our facility. We also have a pharmacy project, and I'm personally really excited to have completed. It's again being done by our in-house construction crew. Many of you that I'm sure have been here for years have noticed that our outpatient pharmacy has historically had 2 windows available to serve our veterans, and I'm pleased to announce that within the next 30 days that's going to go from 2 windows to 4. And that I know will be a big satisfier for our veterans because looking at our veteran satisfaction scores, their wait times in outpatient pharmacy are actually the #1 dissatisfier for veterans in our healthcare system, and that's specific to our Temple campus. So really looking forward to that construction project's completion, and looking for the feedback from you all and from our veterans on whether or not it met expectations. On the Waco campus, our, again, in-house construction crew continues to do great work on Building 91 that we'll be using for swing space once our CLC renovation project is underway. I also had the opportunity about 3 weeks ago to walk the blind rehab unit where, again, our amazing in-house construction crew has gone in. They're doing some flooring replacements, doing some furniture replacements, and just giving the place a nice facelift. And that's really coming along. And also plan to continue to work with our leadership in the blind rehab unit to see if we can find a way to expand that program. On the Austin campus, I don't recall if I gave you an update on the mobile MRI, but I did want to share that with you today. Historically, we've sent a number of veterans in Austin to the community for MRI studies because we just simply haven't had the capacity with the growing veteran workload that we've had in the Austin market. But I'm really pleased to announce that we did award a mobile MRI. They're there on base at the Austin clinic, and we're doing studies on a daily basis. And I've already heard the positive feedback from our staff that they don't have to rely so much on community care and have immediate access to veteran images when those studies are done. A few other updates more in the public affairs realm. I'm really pleased to announce that we are currently airing our very first television commercial for the Central Texas Veterans Healthcare System. This has been a concerted effort with our Public Affairs Office and with our Outreach Committee, and that we really identified the Bryan College Station market to be underutilized. And we saw that there are a number of student veterans that are attending colleges like Blinn and Texas A&M, and that we could do a better job reaching out to. So in addition to putting some staff on campus at Texas A&M in our VITAL program, we also decided to put out a television commercial. So that has been airing on KBTX, and it started in June and will actually be airing through approximately July 7th. And we did have an opportunity to share that in the morning report, and if we can, we'll see if we can put a link to that video on our homepage so you all can take a look at that as well. Something else that I want to share with you that I think is really important, not just to the Central Texas Veterans Healthcare System, but is really important to the Department of Veterans Affairs. In April, VA went live with a program called Medallia. Many of us in the healthcare system are accustomed to hearing terms like speak to the director and the forms that veterans can fill out around the hospital and drop them in the little wooden boxes and we pick up when we get back to them. Well, there's a new tool that VA has published called Medallia. This is public software that we purchased from a private organization. Many Fortune 500 companies in the United States use Medallia to survey their customer experiences, and we're now doing the same thing. The great thing about Medallia is it's real time. What I mean by real time is that within 24 to 48 hours of a veteran leaving our organization, they get either an email or a text message on their personal cell phone or personal email that they can go in and respond to, and we immediately receive those responses. They tell us things like how much they trust the VA. They tell us where they received care, if it was primary care or they just came in to pick up medications. And they tell us what went well and they tell us what didn't go well. I do want to share with you that resoundingly the comments so far have been pretty positive. We've achieved as a healthcare system about an 84% trust score, meaning when we ask veterans in the Medallia survey, do they trust us? About 84 to 84.5% of our veterans are saying they trust us. I actually have a few comments that I wanted to share with you all, and I just picked a day. I picked June 20th, and actually scroll through the comments to see what veterans had to tell me about their services in the healthcare system on that particular day. So here are a couple that were worth sharing with you today. So this veteran said, this was a comment they left for me on June 20th at approximately 6:18 p.m., very specific. He said, I'm very proud of my VA clinic here in Brownwood, Texas. Dr. Childers is my primary provider, and I'm very grateful to be a recipient of his professional service. My wife has stated she is very impressed with him also. I am a proud American veteran. So very nice. Another comment, same day, June 20th, this one at 6:07 p.m. I've had nothing but great service from the Austin VA. Another comment, you can also tell when our veterans are up late. So this particular comment came in at 3:59 a.m. This one says, the doctor and staff at the Bryan VA Clinic provide the best medical care I have ever had. They listen to my medical problems, discuss options, and then we choose the best treatment for me. Last but not least, from Medallia comments I'll share with you, this one also on June 20th at 12:07 a.m. I have had only good experiences at the Temple VA. Friendly staff, timely appointments, and exceptional service. And this person says, even at the lab and pharmacy. So what I think is important to understand by all staff when we talk about Medallia, I have charged our services with ensuring that everyone in leadership in their services has access to Medallia and that we're actively using it for service recovery. I go in regularly and look at the comments from veterans, look at the responses from the services, and I want to be sure that we're following up with our veterans to ensure that we're meeting their needs and that we're doing it in a timely manner. But Medallia, I think, can be a major asset for our organization and help us with service recovery. So I look forward to your participation there. So in closing today, I have a moment of reflection that I'd like to share with you all. And I actually got this last week. I went to a homeless summit, or mental health summit, on our Waco campus. And at the start of the summit, one of our chaplains there on the Waco campus came up to provide a moment of reflection. And it really resounded with me because of some experiences I've had over the last quarter with stakeholders and some experiences I've had with our staff. So let me tell you what the context was here. The moment of reflection from the chaplain talked about forgiveness. And here's what was expressed. They said there's 3 phrases that are really important for people to learn and that the impact these can have on relationships. The first one was learning to say, I'm sorry that I hurt you. The second was learning to say, can you forgive me? Or asking for forgiveness. And the last was to say that I forgive you. Now let me contextualize those for myself. Some of you, if you have been watching the media, I've been very busy over the last 3 months as we've talked organizationally about some changes that we're making, especially with some of our mental health programs and our PTSD and Women's Trauma Recovery Unit and some of the exchanges that we've been talking about with clinical programs across campuses. I had the unique opportunity about a week ago now to go up to Waco and talk to the city council there. And what I had to acknowledge to the city council is that I had to appreciate that particular community had itself experienced, I think, a significant amount of PTSD in the past as there were discussions about closure of that campus, and realizing that that had nothing to do with what we were currently discussing. I had to put myself in their shoes and realize that I had to be a bit more sensitive to the impacts that some of these changes can have on communities, and being willing to let folks know that, you know what, I think we could have communicated that change a little bit better. I think we could have listened to the community a little bit more intently. Doesn't mean we're going to change the decision, but it does mean that we can take the time to acknowledge that perhaps the approach could have been a little better. But I've also seen opportunities to use this moment of reflection that our chaplain expressed amongst our staff. There are a lot of moving parts in our healthcare system, and as a result of that, sometimes relationships between we as coworkers can become strained. But I think what's most important to repair those relationships is for our staff to also have the ability to acknowledge when we've done someone wrong, either intentionally or unintentionally, and to ask them for forgiveness. But I think it's also important for those who feel that maybe they've been wronged to be willing to forgive. And I think if we all take a moment to reflect on what our chaplain had to share with us, I think as a healthcare system, we'll be better and we'll be stronger as a family. So with that, I want to thank you for choosing Central Texas Veterans Healthcare System, and I look forward to speaking with you again. Thank you.